It's the Elephant in the Dome, the official podcast of the Washington State Senate Republican Caucus with Senator Chris Gildon. Washington's Keeping Families Together Act makes it harder for the state to take a child out of their home by requiring proof of an immediate physical threat and putting a huge emphasis on staying with relatives instead of going into foster care. Joining us is Tracy Jefferson, a foster parent with a background in healthcare who has firsthand experience with the act. Here's Senator Chris Gildon.
Hey, well, good morning, Tracy.
Good morning.
Thanks for joining us today. This is awesome.
Absolutely. Thanks for having me.
I know we've had a long relationship over email back and forth, but it's good to actually have you in the studio today and have this discussion.
Yeah, thank you so much. I really appreciate the opportunity we get to shed any light on this subject because it's so important for our state. It
is, I know. And I mean, I've got to say, I've been really impressed with your level of knowledge on this issue. All of the emails that you've sent to my office, just spot on with policy. I'm really impressed with that.
Thank you.
Yeah. But today we're talking about this House Bill 1227 and the Keeping Families Together Act. And kind of to set the stage, what is it? What problem was this bill trying to solve and how did it solve it?
Yeah, it was put forth in 2021. That was when it was passed. It went into full effect in July 2023. The sponsors of this act said that they wanted to accomplish a few different things. They wanted to reduce the number of children in foster care. They wanted to try and address racial disproportionality in the system. And they also wanted to try and make a standardized threshold for removal that they said was on par with the Indian Child Welfare Act.
So they just had the idea that there were too many kids going into foster care and it was better if they stayed with family members for the child. That was kind of the idea.
That's kind of the premise that they started with. And they cited a lot of research that supported their idea. Unfortunately, I think a lot of it was misguided. As far as some of the research talked about separation of families and outcomes from foster care, but failed to address the root cause of why children experience these outcomes, which the reality is they experience many of these outcomes because of trauma and what's called adverse childhood experiences, as opposed to truly the separation from biological family. Now, we know children do better across the board if they have safe, stable, nurturing relationships, and that those relationships are best served with their biological family.
And we wish every biological family could provide that safe, nurturing space, but that's just not the case, is it?
No, it's not. And unfortunately, along the way, we've lost prioritizing the safety of the children, and we're sacrificing them with this concept of family at all cost. And that's what's really the devastating outcome of this act.
You mentioned the removal standard and that they wanted to have a single standard that applied statewide. What is it, and is it being applied statewide in a like manner?
Yeah, they set forth the standard in the Keeping Families Together Act with the language of imminent physical harm. And along with that threshold came a burden of proof for our social workers, our caseworkers on the front lines, to prove a direct correlation between conditions of the home, substance use, neglect, and imminent physical harm.
What would the imminent physical harm be? Like, what would that mean?
Well, that's where everybody's really struggling right now, is because there's not a definition to that. And if you look at the definition of imminent, that means it's about to happen. And so what our caseworkers have said is that they practically have to have a crystal ball to know when this is going to happen so that they can intervene just in time and when the imminent part is present. The other challenge is that there's a lot of conditions that are child maltreatment that don't result in direct physical harm or objective findings that we can present to a court. So, for example, emotional harm, developmental harm.
Yeah.
And unless if we have a really egregious case, even cases of sexual abuse don't result in evidence of physical harm until the child's really suffered a tremendous amount of trauma.
So even sexual abuse doesn't rise to the legal definition of imminent physical harm?
You have to have proof of it.
Wow. But I suppose because we've kind of left it to the courts to interpret what that threshold is, what is imminent physical harm, probably some courts are a little more lenient, some are a little more strict. Is it?
Well, and one of the things that we're seeing is that because of that threshold, right, a lot of these cases are never actually making it to a court hearing. So there's a process in the dependency where you intervene, you remove the child, you have a shelter care hearing, and then there's a dependency process. But a lot of these cases have never even made it to a shelter care hearing so that we can establish case law around the definition before the child suffers tremendously or, unfortunately, they're killed.
And
in one of the cases, I believe it was 85 intakes were documented in the fatality report, which is 85 opportunities we had to intervene and support this family and keep their children safe. And instead, they all screened out or were unfounded until the time the child died. And then we gave the parents a founded finding of abuse and neglect, which is a complete systemic failure to help that family be together forever. And that's one of the things that's really heartbreaking also, is we call it the Keeping Families Together Act. These kids and their families are never going to be together again if they die.
Yeah. So just to make sure that I understand this, this is one child who had been involved with the system 85 times before they finally passed away?
One family.
One family.
With 85 intakes before the child, in this case, eventually died.
I mean, that's absolutely
known substance
unacceptable.
abuse, known difficulties in the home. We're not saying we want kids removed for things like poverty, right? We want to help families thrive. We want to help families be successful.
Yeah.
But there comes a point where we have chronic patterns or repetitive patterns, and there's tons of literature out on this that we have to acknowledge if we're going to do what's right for our next generation of Washingtonians. And when there's chronic patterns, we can't intervene because of this threshold of imminent physical harm. And each intake, each case, and even each child is considered separately for that threshold. So if you meet that threshold for one child, it doesn't necessarily mean that threshold has been met for other children.
Other children in the same house, say
In
a
the same
brother and
home.
a sister.
Yes.
Wow. And so, I mean, but just to put a point on it, I guess, is that's why this is so important and so impactful, is because like children, infants, toddlers are dying because they're not being put in foster care, even temporarily, while their parents deal with substance abuse issues or whatever the case may be. Is that right?
Yes, that's correct. And we have had a lot of conversations around the critical incidents, which is really what opened this proverbial can of worms, right? Is the Ombudsman last year in July 2025 came out with some data that was just appalling. They said in the first 6 months of 2025, 92 children had died or nearly died.
92.
That's a child every other day.
Wow.
And that's just the tip of the iceberg of what we're seeing happen, right? Because for many of those children, they also had siblings who didn't get counted in those statistics, but also suffered immense trauma. For example, there was the little girl in Federal Way who was murdered by her father and tortured. And she had siblings who also had suffered years of abuse and neglect.
Oh, my goodness. You know, and I read a report from the DCYF, the state agency, and they really recommend that we don't make any changes to that standard right now. They think that it's doing good. They cite that, I think it was, what was it, like 44% fewer, 9.6% fewer people going into foster care. And then they cite that, you know, they have the harm reduction kits that they give to families. And they're very proud. A statistic they had in the report said that they had 753 doses of Narcan had been administered to reverse overdose since they started doing that.
Yes. Yeah. I struggle with, I'm familiar with what you're referring to. I think it was 23,000 harm reduction kits handed out in Washington. And then, like you said, 753 doses of Narcan administered to save lives. And we asked for some data on those 753 doses of Narcan. We said, well, there's not 753 critical incidents. And Narcan is used as a life-saving drug, meaning we're using it to reverse something that otherwise would likely become a fatality. So those should be counted as near fatalities. Was this children who have then had the burden to administer Narcan to their parents, or parents who had to administer it to their children, and then the child was doing okay, and so maybe they never showed up at the hospital, or siblings who had to administer it to each other, because those are all traumatic experiences for a child, regardless of why we got the Narcan in the home in the first place, right? Like no
Wow.
child should have to witness that. The harm reduction kits do have a broader use other than just being given to children who are involved with the child welfare system. And there are some good applications of that. For example, parents who maybe have a teenager who's struggling with addiction. Parents
Sure.
should be armed with the things they need to save their child's life. But Narcan's not a safety plan. And I agree, they have reduced the number of children in foster care, but there's one key word they're missing there, which is they have not safely reduced the number of children in foster care if we're seeing this sharp rise in critical incidents. They also left out a key part in their goal to reduce the number of children in foster care, which is that number was already on a natural downward trend with the other prevention services that were getting put into place years before the Keeping Families Together Act was passed, but without the sharp rise in critical incidents.
Interesting. Wow. I mean, this is just such a big deal. You know, we've worked really hard in the legislature to get fentanyl added to the list of items that would be considered child endangerment if you exposed them to it.
Right.
We passed that bill, I think, out of the Senate 3 years in a row, and then it went over to the House and just died every single year. And it's an interesting thing because the statute lists the various drugs that would be considered endangerment, but fentanyl didn't exist when the statute was written, and therefore it's technically not illegal according to the law.
And that's one of the things that we challenge everybody on also is let's get away from listing individual drugs. Let's just say if there's illegal drug use in the home, it's not safe for a child. Because drug dealers are smart, right? They're always looking to make the next thing that's more addictive, the next thing. I mean, it's a business, right? And we have to acknowledge that it's a business. So they're looking at what's more cost effective. We've got carfentanil coming onto the streets now, and another medication that I'm drawing drug that I'm drawing a blank on the name for currently, but it won't even respond to Narcan. And carfentanil is 100 times more potent than fentanyl itself.
Really?
And it's already getting cut. We had a seizure down in Centralia or Chehalis area already of these drugs.
Wow.
And we're seeing it take more and more doses of Narcan also to reverse opiate overdose. But then we've got drugs where it won't work on. There was one little boy who was shot in the head by his father while his father was under the influence of PCP. He was under a year old. So we can't isolate it to just one drug or one list of drugs. We have to just say, if there's illegal drug use in the home, it's not safe.
Now, before we get into some of the solutions of this, clear one thing up for me, because I've heard what may be considered like an urban legend, or maybe it's true, I don't know. But because of the removal standard is so high, they have to come up with safety procedures, a safety plan for these families. And one of the things that I've heard is that a judge actually ordered, because both parents were addicted to drugs, and the judge said, well, okay, just don't use drugs at the same time, like alternate times when you're high, and then that's your safety plan. Does stuff like that actually happen?
Sadly, it does. Yeah.
Really?
As long as what our current laws and policies say is that as long as one parent is able and sober to care for the child, then we can't remove the child. So if we alternate drug use, then there's one parent, we can argue, that is always available to care for the child. Now, we know addiction and substance use doesn't work like that. And in some of my meetings, I've said, let's pretend that world exists. Let's pretend somebody can safely use around their child and lock those drugs away and put them away and make sure there's no paraphernalia or residue left for the child to get into. Let's pretend that world exists. What environment did they have to go into to get those drugs? What types of people are they using the drugs with? What's the increased incidence of childhood trafficking for kids that are in drug-affected homes? There's mountains of literature on there. So even if we say like that's an acceptable safety plan, which I adamantly disagree is a safety plan. There's all these other factors that we can't control for in the case law that only involves the parents of the child.
Interesting. It's just such a big ball to unravel. So what do What would you do if you can just give us like one or two things that we could change in Olympia that would help make this problem, help alleviate the problem and keep kids safe? Like what would be a couple of things you would do?
Yeah, one of the first things we need to do is we need to either remove the language imminent physical harm and give us a broader scope for what harm means to a child, or we need to clearly define what imminent physical harm is and give that some framework for everybody to operate from. The other thing, like I said, is we have to acknowledge that illegal drug use in the home is not an environment that any child should grow up in. We know that increases their risk of substance abuse later in life. We know that it increases the risks for homelessness, for mental health disorders, so we have to address that. The other thing that we have to do is, because of this burden of proof that happened with the Keeping Families Together Act, we have caseworkers who were already overburdened before this, who are now having to write 40 and 50-page declarations to try and prove what they've done for reasonable efforts, what they've done to mitigate the safety risks in the home, and what they've done to try and keep this family together. And so we've added countless hours of work onto them, which then takes away their ability to build their relationship with the family and truly intervene the way they want to and support these families. And so I really do believe we need to get back to some safe staffing levels and some safe caseload levels. And that's cited again and again in DCYF's fatality reports.
You bring up a really good point, and this is something that we've worked on also, and we've brought up, and probably we have a chart. I think we'll try to get the chart up on the screen, but it shows the staffing levels at DCYF, and it shows mid-management, and the trend is just going upward, almost at a 45-degree angle. And then it shows hiring overtime of frontline workers, and it is almost flat. I think DCYF needs a complete realignment of how they allocate personnel, and they certainly need more frontline workers.
I agree. And it's just sickening when I see things in requests from them for their budget, like extra people to do fatality reviews. No, let's get extra people on the front lines so that we don't have to do the fatality reviews. That's real risk mitigation.
Yeah, let's get ahead of the catastrophe, right?
Yeah. And really, there's nothing in our state that gets better if we don't fix this. We know that this has a significant impact on our state's budget. We know that nationally it has a significant impact on budgets. There's one organization called Kids at Risk Action who estimates the national cost of child maltreatment at $14 trillion.
Oh, my.
And so if we extrapolate that to what's happening in Washington, we know that we can change the trajectory of our budget if we start addressing child maltreatment. We also know that perpetuating substance abuse doesn't help us get ahead of our drug crisis. We have kids that are as young as 7 and 8 years old who are using drugs with their parents, who are receiving services from our state. And we can't...
So it becomes generational.
It becomes generational, and we perpetuate these cycles. We know that kids that experience maltreatment are more likely to be homeless. And so we're not fixing that. We're not getting ahead of our educational outcomes. This really is a root cause analysis of things that we can do that protect the innocence of childhood, honor our next generation, and save Washington.
It seems like there's so much that we could do if we just applied sensible solutions in order to, protect the most vulnerable among us. Right?
Absolutely. We call it a child welfare system, and I think what we really need to start looking at is how do we make this a child-centric child welfare system.
There you go. Tracy, thank you so much for joining us and bringing, your expertise to this subject today. I really appreciate you coming down and taking time to do this.
Yeah, thanks for having me.
You got it.
That's Senator Chris Gildon with Tracy Jefferson. Again, a big thank you to Tracy for joining us. Please subscribe to this podcast and also subscribe to our YouTube channel. The Elephant in the Dome with Senator Chris Gildon is the official podcast of the Washington State Senate Republican Caucus.